Now at 5 o'clock with important information for parents. A report that tracks the well-being of Colorado children shows many kids and families are struggling. Good evening. Thanks for being with us tonight. I'm Karen Lee. Michael has the night off. The Colorado Children's Campaign released its annual Kids Count report today. Now, among some key findings, 1 in 3 kids live in a household that spends more than 30% of their income on housing. The cost of childcare is 1/6 of the total income for a married family and nearly half the income for a single-parent family. Immunization rates for all vaccines we've learned are also down across the state. Your reporter Kelly Worthman, looking into this data, joins us now to talk a little bit more about this. And Kelly, you visited a clinic that sees firsthand some of the challenges that these families are facing, as it's spelled out here.
Absolutely, and it's impacting more Coloradans than people may realize. 1 in every 9 children here in Colorado doesn't have health insurance, and this has a lot to do with what is being called the Medicaid unwind, where, as of last spring, families are being disenrolled from pandemic-era provisions that kept them covered during the public health crisis. Many of those families didn't know and may still not know that they've lost that coverage. Well, now community clinics like Kids First Healthcare in Adams County are working hard to get Colorado children the care they need.
Kids aren't getting their basic needs met, their well child checks, their immunizations, their physicals.
It's an issue Bobby Garcia Abrego sees just about every day. Colorado kids in need of health care and families overwhelmed with the loss of coverage.
The application process can be grueling at times. These new renewal applications that they've sent to families, depending on your household size, it could be upwards of 17 to 30 pages long.
According to a new report, nearly 147,000 Colorado kids have been disenrolled from Medicaid since the state began terminating coverage in June last year.
If families moved or if they had a family change or an income change.
Bobby says it's not too surprising so many kids are without health coverage given the end of automatic Medicaid renewals, but she's doing all she can to help.
There's a huge backlog, and I think that time getting families re-enrolled is what's taking a really, really long time.
Now, Bobby tells me there's also a shortage of workers at the county and state levels who can help families apply for this coverage, so that's also part of the backlog. Kids First Healthcare does have 8 clinics in Adams County, but they also offer support for families all across Colorado. We have their information about those community clinics as well as all of the resources on our website. And of course, Karen, a big challenge for Colorado families is the cost of living. We all know that, right? So a lot of these families that are considered low income, they're having to make the decision of, do we pay for our rent, our mortgage payment, or do we go ahead and get our kids the medical care that they need?
Yeah, groceries, everything. So
right.
much with inflation right now, too. The report released today, Kelly, also shared some alarming stats about poverty in our state and actually detailed the amount of money that people have a day. We're talking about some families living off $9 a person per day.
Yeah, isn't that sad? I mean, 66,000 kids in all of Colorado are living in what they call extreme poverty, which is defined as families making less than $14,000 a year here in Colorado. That means 6% of kids in our state live in extreme poverty, and that number really hasn't changed much over the last decade. The Colorado Children's Campaign saying today that our state is making little progress to reduce poverty among kids. But Karen, there are also some bright spots in this report. We don't want to only focus on the negative, right? There's some good things that are happening, like more equitable funding for schools across our state, greater access to mental health care, and we have passed some tax credits to help those low-income families as well as child care workers. If you're interested, if you want to read this entire report, it's also on our website.
Certainly a lot more to be done.
Absolutely.
All right, Kelly, thank you for breaking that down for us.